George M. Gould, a physician and medical ethicist, made a bold proposal at the turn of the century that every American should undergo an annual physical examination. This wasn't just about detecting illness, it was about instilling discipline, accountability, and self awareness. Gould believed that health was a reflection of character, and that maintaining it should be part of one's moral and civic responsibilities. In his view, the human body wasn't just a biological system, it was a moral vessel. To care for it was to uphold one's duty to self, family, community, and even God. Annual exams were seen as acts of both prevention and purification, a kind of sacred check in. What's more, Gould's proposal aligned with growing movements in insurance, education, and public health that were pushing for standardized, measurable, and population wide assessments. His call anticipated a healthcare model based on surveillance, measurement, and early intervention, the same infrastructure that clinical engineers support today. So while Gould may not have been an engineer, his ideas planted seeds that would grow into the routines, technologies, and ethical expectations that now define modern clinical care. The turn of the 20th century was a pivotal moment for the United States. The population had reached 76 million, sparking new attention to public infrastructure, urban development, and population health. Globally, tensions were also mounting. The Boxer Rebellion in China highlighted growing conflicts around imperialism, national sovereignty, and global instability. While distant from domestic healthcare, these events reinforced an American concern with national strength, order, and readiness, both at home and abroad. In this environment, there was a sharp national focus on health, hygiene, and social order. Public health reform was gaining traction. School screening, sanitation movements, and medical standardization efforts were on the rise. Disease wasn't just a personal concern, it was seen as a threat to productivity, morality, and civilization itself. George M. Gould's proposal for annual exams must be seen in this context. His call to regularly assess the health of every individual was not only about medicine, it was about building a disciplined, organized, and morally upright society. It's this same framework, health as a system, as responsibility as structure, that would ultimately support the emergence of clinical engineering later in the century. Gould believed that every citizen should undergo a yearly physical examination. But what made his argument powerful wasn't just its practicality, it was how deeply it tied health to morality, discipline, and citizenship. To Gould, this wasn't about more than preventing disease. Annual exams were a form of self regulation. They kept individuals accountable not just to themselves, but to their families, their communities, and their country. In this way, health was reframed as personal infrastructure, something you maintained like a road or a bridge to keep society functioning. He emphasized three key ideas: prevention, discipline, national benefit. Prevention, catching problems early, was more humane, more cost effective, and more dignified. Discipline, just like good workers or students, a responsible citizen should care for their body. National benefit, a healthy population meant a stronger, more productive nation. This thinking wasn't just for public health officials, it laid the conceptual groundwork for many of the monitoring systems we rely on today. And this is where clinical engineering comes in. Gould's vision required tools, scales, blood pressure cuffs, thermometers, and those tools required trust, precision, and maintenance. So clinical engineers ensure those measurements remain reliable, ethical, and consistent. In many ways, they've inherited Gould's belief that care is a system and that systems must serve both truth and the people they protect. In the early 20th century, health was not only seen as a civic duty, it was widely viewed as spiritual responsibility. Annual physical exams, like the ones George M. Gould advocated for, were often framed through a Christian moral lens. Regular checkups weren't just smart, they were signs of self discipline, part of a larger commitment to steward the body as a divine gift. Cleanliness, bodily awareness, and preventive care were moral imperatives, not just medical ones. This was the era of the social gospel movement, where churches and reformers preached that caring for oneself and others was a form of devotion. To be clean, organized, and in control of one's body was to be aligned with spiritual ideals of order, clarity, and respect for life. This view also meant that bodily health reflected inner character. A person who neglected their health might be seen as lacking in self control or virtue. By contrast, regular physical care demonstrated humility, responsibility, and the respect for creation. These beliefs fed directly into the rise of preventive health systems, and they live on today in how we think about the system design, patient safety, and the ethical work of clinical engineering. Clinical engineers don't just fix machines, they ensure that systems reflect trust, care, and moral clarity in how we treat the human body. Gould's push for regular physical exams didn't just shape public health, it also established a pattern of ongoing health surveillance that now depends on technology and engineering systems to function reliably. Today, clinical engineers are the people who make that consistency possible. From calibrating blood pressure monitors to maintaining electronic health records and imaging systems, engineers are responsible for ensuring that the tools used in patient checkups are accurate, safe, and dependable. This goes beyond just mechanics, it's about ethics, the ethics of care, of embedded systems with engineering design that they maintain so that patients, when they step on a scale, when they get their heart rate checked or undergo diagnostic scans, um, well, they're placing their trust in the healthcare system. Clinical engineers are the hidden professionals who uphold that trust through routine testing, documentation, and failure prevention. So while Gould championed prevention and self discipline, today's engineers preserve that same ideal, but through technical stewardship. They maintain the rhythms of checkups, screenings, and diagnostics, allowing modern healthcare to be both routine and reverent. To conclude, let's return to the core contribution of George M. Gould. His push for annual physical exams wasn't just a policy proposal, it was a framework. He helped redefine care as an ongoing moral practice, one that should be systematized, consistent, and built upon personal responsibility. Annual exams soon became a cornerstone of modern preventive healthcare. And what's essential to remember is that their success wasn't just about doctors. It was about the tools, the infrastructure, and the routines that made them scalable and trustworthy. This is where clinical engineering finds its moral inheritance. Today's engineers continue Gould's mission in a different form. They design and manage the systems that keep patient monitoring consistent. They calibrate the tools that ensure detection is accurate. And even if they don't calibrate the tools themselves, they ensure that the tools get calibrated, properly. They maintain the infrastructure that allows prevention to remain reliable. So, in essence, clinical engineers are the caretakers of care. They uphold the silent promise Gould envisioned that health is worth guarding, not just with intention, but with precision, with reliability, and most of all, with integrity.